All right. Hello, everyone. This is Gisela, and good evening, and welcome to Ask the Experts. And today we are here, and we are doing another Ask the Experts. And we have two special people here with us tonight, and we're going to be having some very interesting questions, regarding the holidays coming up and all the stress that goes along with the holidays, and obviously with COVID-19. Again, my name is Gisela, and I'm the COVID-19 outreach specialist here at Thundermist. And we have Dr. Angelica Storms with us tonight. She's a pediatrician. And we have Jenny Gaviria, and she's a behavioral health clinician. So our experts are here to help answer your questions regarding the holiday stress and obviously COVID-19. Holidays. The holidays are coming, and it can be a very exciting time for many, but it can also be very challenging for many as well, especially during COVID-19. While it can be a time for celebration and family and food and all the fun stuff, it's also time when we feel stressed and disconnected from our loved ones. So with the pandemic, it's still among us, as we know. Most won't be able to get together in person. The holidays are going to look a little different this year, but our experts are here to provide some information and insight as to what we can do to basically keep the holiday spirit and minimize the stress. So I wanted to let everyone know at this time, we will open to the viewers to leave your questions or comments below. We will do our best at the end of the questions to answer your questions. And we would like to start off. And I would like to introduce Dr. Angelica Storms.
Hi, my name is Dr. Angelica Storms. I'm a pediatrician here in Thundermist Health Center, West Warwick.
Thank you so much, Doctor, for being with us tonight.
Sure.
And we also have Jennifer. Hi, Jennifer.
Hi, everyone. My name is Jennifer Gaviria. I'm a behavioral health clinician in Woonsocket.
All right. Thank you so much, Jen, for being here with us. And again, we have Dr. Angelica, who is from West Warwick, and we have Jen from Woonsocket, right? All right, awesome. All right, so we're going to start asking some questions that a lot of people are asking. It's going to be a very different holidays, right? Right around the corner, everything, it's like we never had before. So I'm sure a lot of our viewers have a lot of questions regarding what to expect around this time. So I'm going to ask some questions, and my first question is going to be for Dr. Storms. And the question says, what should people be aware when making holiday plans?
Yeah, I think that's a really good question, especially during this situation that we're living with COVID-19. There's certainly things that we need to consider that we never had to consider before during the holidays. So I think that the main things that we have to think about is how can I keep myself and others safe, and what modifications I might need to do to my holiday celebrations and in this holiday season in order to have this safety as much as possible to everybody. And the risk really varies from person to person, and also depending on what state you're living in. So there's a few factors that you need to consider before making holiday plans. You have to consider like the community levels of COVID-19, how high the COVID-19 spread is happening in your in the community that you are living in and that you're going to be celebrating in. What are the plans for gathering, because that's also something to be considering the risk for. If indoor gathering versus outdoor gathering, having indoor gatherings, with a little bit of higher risk. And also, if in your personal situation, if anybody in your family is somebody that is at high risk for complications, then definitely you want to minimize the exposure of that person to potentially anybody who has any COVID-19 illness, or preventing traveling for that person who might be at increased risk for complications. So I think it's going to be it's going to require a little bit more planning for the holidays, not just the festive part, but also the keeping everybody safe, considering my own family, considering the risks, considering what is going to be my plan to reduce the risk as much as possible for me and my loved ones.
That's very, very helpful to know. Thank you so much.
Yeah.
Jen, our next question is for you. And we have, what are some safe alternatives for people to consider when making holiday plans?
So as Dr. Storms was talking about in considering the risk, it really depends on where you live. But if we're talking about Rhode Island, I would strongly recommend everyone to follow the recommendations from the Rhode Island Department of Health. And we're going to put in the comments a graphic that they just printed out and shared about the do's and don'ts of holiday gatherings. So some of the recommendations are, taking it outdoors if it's possible, wearing a mask if you are going to be outdoors or indoors, making sure that you're washing your hands, that you're limiting gatherings to 10 people, but really they're recommending just celebrating with those that you live with. That's really the messaging that they are sending us. So I know that can be disappointing and, can bring up some feelings. And that's kind of why I'm here as a behavioral health clinician, because it is different. And we're adjusting to this, right? To this new normal. So like Dr. Storm said, not only are we planning ahead because of health wise, but also because we want time to process those feelings with our family about how it's going to be different, and talk about different ways that we can celebrate. So maybe we can, meet virtually, have the dinner, but do it virtually, or create new traditions with your family. If you have children, ask your children about ideas of what to do. Maybe you can write letters to people, in the hospital or something like that. Like, there could be a lot of different creative ways that we can still celebrate and, celebrate being thankful. But we do have to consider the risks of being in person.
Yeah, this is definitely going to be a very different holiday, for sure. But those are all great tips for everybody. Dr. Storms, one question a lot of people get in this time of the year is it safe to travel this holiday season?
Right. So regarding this question, I think it goes very linked with what Jen was just saying. Certainly, there's a lot of things to take into consideration when making the decision to traveling, because traveling can increase the risk for transmitting and spreading COVID-19. As Jen was saying, staying at home and celebrating with your household is sort of like the best way to for sure prevent contracting COVID-19. There are certain factors that can make travel more or less risky, and also considering your own risk and the other people that are going to be traveling is also something important. For example, my parents, they're in their 70s, so they're not going to come and visit me And I'm pregnant, so that also places me somewhat at risk. So in my particular situation, we're not going to be traveling this season. We're probably going to be doing something, like Zoom-wise or, different ways of celebrating, which is also perfectly okay. Now, in regards to factors that we need to consider traveling is, okay, so what makes travel risky? It can be the fact that, in train stations or in, airports, you might not be able to do that social distancing that's recommended. If you're in a bus, you won't be able to do that. You're going to be sitting next to somebody. It might not be as well ventilated, so that does increase the risk. The other factors that you need to consider, like I was mentioning, is, okay, so where am I traveling to? How high is the prevalence of COVID-19 to the place that I'm traveling to? If you do decide to travel, that's one of the things that you need to consider. Am I going to be able to wear, a mask? Am I going to be able to social distance appropriately? For air travel, there has been some information, some studies that it seems like the air circulation is okay for airplane travel, but you definitely want to, if you do decide to take that risk and do the air travel, you definitely still want to use a mask at all times. You want to maintain that social distance as much as possible, and you want to do hand washing or appropriate hand sanitizer as much as possible. So that those are sort of like the things that you need to consider with traveling, and how much risk you're willing to take when you do make this decision regarding traveling.
Yeah, especially because a lot of people do travel at this time of the year. A lot of people go to back to their countries to spend with their loved ones, even sometimes, to a different state. So this is definitely not a good time to be doing that. Right. Then you have to come back and you have to quarantine. We have all those factors that everybody should take into consideration. Yeah. So that's very good information. So for everybody out there, not so quite okay to go do some traveling right now. That's great. Thank you. Jen, how should people address religious obligation during this holiday?
Yeah, so I think that that's something that not just during the holiday, but I think throughout this whole time period, it's something that people have been concerned about. And I think it's, following the guidelines of the state, following social distancing, washing your hands if you do go. Hopefully, your community of faith is, doing some virtual giving some virtual opportunities for you to join that way. But again, like Dr. Storms was saying, it's really person to person and seeing what your risk is. But we hope that everyone is following the guidelines. The church community should be the one, following those guidelines and doing the cleaning and all of those things. So it really comes from them. But if, as much as possible, doing things outdoors. I think I've seen some church communities do that, and doing it virtual. It's really what's recommended.
Awesome. Thank you. Thank you. I know my church does outdoor as well. And we'll continue to try to keep doing outdoor. It's the safest way to go about right now. So, okay. Dr. Storms, what can I do to keep my family safe this holiday season?
Yeah, I think this question goes very much linked to everything that we've been discussing regarding what things can we do, what things do we have control of to decrease the risk as much as possible. So certainly doing virtual celebration would be the safest way to go, where you're not actually, seeing anybody in person or putting anybody at risk, participating with in holiday events and celebrations with your own household. So those are the ways that you can decrease the risk. For other in-person, like if you're going to be doing a gathering, doing outdoor activities, especially, right now it's fall, so it's still nice outside, and you can certainly take advantage of it now. That might be a limiting factor in the winter, though, so it's something to consider. If you do have to do like indoor activities, having it, a really well ventilated area helps a lot. Wearing masks at all times, even when outdoors, having cleaning hands frequently, washing them using hand sanitizer, and also the way that you greet people has changed. So maintaining these close contact, pretty much avoiding hugging or handshaking or kissing in the cheek, which in the Latin population we do a lot. so you're gonna want to minimize that, or just sort of like wave at a little bit more of a distance, making sure that you might have to forego like the potluck situation. So avoid doing any buffet stations, because you don't want to be grabbing everything. You might want to do like more little individualized boxes of food if you're going to be doing an in-person gathering. So yeah, things like that.
Okay, a little bit hard for the Hispanic population not to give a hug, but we have to keep safe, right?
I'm struggling with that too. I'm like, okay, I guess we don't kiss on the cheek anymore.
I know. Okay, Jen. So, what are some ways to alleviate the stress during this holiday season?
So that's a great question. And before I go into that, I think we need to talk about like what the signs of stress are, so that you know when it's happening. So if there's any changes in your sleep, like if you're sleeping too much or not sleeping enough, if you're eating less or eating more than you used to, constant worrying or difficulty controlling your worries, any changes in your mood, if you have increased use of tobacco or substance use, all of those are, signs of stress. If you struggle with your mental well-being, and you are in a crisis, it's important, to call 911 first. If there isn't, if you're having suicidal ideation and you really are thinking of hurting yourself or somebody else, that's important. But if, you're not in a crisis yet, but you are noticing these changes, it's important to focus on what you can and can't control, right? Sometimes we're in our heads and we're just kind of worrying, but we really are not doing, there's no action, there's no solution if we're just worrying it in our head. So focusing on what we can and can't control is a good way to help manage our stress. I would also say like making sure that we're eating a balanced meal, that we're exercising, that we're spending time outdoors, that's still nice out. Making sure that we are talking to friends and family. I know right now we're not seeing them in person as much. So making sure that we still talk on the phone or do Zoom, and kind of scheduling that, and putting that in our schedule. Limiting the news, sometimes that can make it even, make the stress go even higher. So, limiting it to 15, 30 minutes a day, and that's it. Is really important to manage our stress. Disconnecting from electronics. Right now we're living in Zoom world, right? I know some of it, what we're recommending is, do a Zoom, but like we're doing it at work all day. We're doing it, to see our friends and family. So sometimes just kind of decompressing and just kind of taking some time away is also important. and think practicing self-care. So self-care is really, it's not about just like, bubble baths or going to buy something that's going to make me feel good. It's different things. It's really about what makes you happy and including more of that, right? So like reading, does that bring me joy? Does listening to a podcast, listening to music, talking to a friend, participating in my church community, what is it that makes you happy? Because I know especially parents right now are dealing with a lot of stress, right? They're working and then they also are teaching. And or even if they're not working, they're still becoming teachers and they're not trained teachers. So that's stressful in itself. So I think also it's really important for parents to remember like themselves and do some self-care and do things that they like to do and find joyful, because sometimes this has been kind of consuming, right? Now everybody's home, so there's more housework. And then you also are teaching the children and that brings up other stressors, right? So I think that self-care is really important as well. And then, if things are not really changing for you, and you're doing all these things, talking to a counselor, a therapist is a good way as well to help manage your stress. We have counselors at Thundermist on all 3 sites, and you're able to obtain counseling through Thundermist if you are a patient of Thundermist. So those would be some of my recommendations. And then also think about what is it that is making you stressed? Like, is it COVID-19? Is it the holidays? What is the source of the stress? Because maybe it's you have a lot more, household chores. So can other people in the household, help you out with that? Are we taking on too much? Like, what is the source of the stress? Sometimes we're just like, I'm so stressed, but we don't really identify what it is. So I think that's also another recommendation.
Great. Yes, thank you very much. So basically just keep an eye out for, loved ones and friends about if they're stressed, if you see different changes on their behavior, all the signs to watch out for. That's important. Thank you, Jen. Dr. Storms, there's a question. Is there a safe treatment for COVID-19?
Yeah, so as we've seen more and more clinical cases of COVID-19 in the past few months, I think that we've seen that there's a really broad clinical presentation to this illness. And as mentioned, I'm a pediatrician, so many of the cases that I've seen in the pediatric population of COVID-19, they've actually been quite mild, similar to other viral illnesses, or asymptomatic, although there can also be severe cases of COVID-19 in the pediatric population. So it's sort of the treatment of COVID depends on the clinical presentation and the severity of the symptoms. If a patient has very mild symptoms, not having any respiratory distress, being able, to eat and take fluids and everything, then the treatment is very similar to other viral illnesses with supportive care and measures and monitoring for complications. However, so in children, making sure that they're keeping themselves well hydrated, that, on infants that we're keeping their nose nice and clear with bulb suctioning and nasal saline, things like that. As well as making sure that we're following the Department of Health's recommendations regarding isolation and quarantine. That's also very important. Now, if complications arise with, difficulty breathing, shortness of breath, low oxygenation, things like that, that's when, patients are typically hospitalized. And in the hospital setting, we have other treatment options and modalities, such as using oxygen to help with the oxygenation. And then there are other medications that have been, considered safe in certain situations in the hospitalized patients, such as the antiviral remdesivir, and also considering use of steroids and things like that. But I think that what the general population should know is that it's really, it really does depend on what clinical presentation you're having. So if you have any symptoms, you can definitely talk to your PCP or your pediatrician, and then we can guide you towards testing, and then we can sort of like help with the management of symptoms and treatment and monitor for these complications.
Great, thank you. Jen, what are some ways to have a tough conversation with families about staying safe and protected during the holidays?
So, my role is to always have tough conversations, right, with people. And I think, what we've kind of mentioned is starting to have those conversations now, to give people room to process, to plan ahead, to figure out what it's going to look like this year. It's also important to use what we like to call I statements. So instead of saying, I don't want you to come because you're going to act this way, saying something like, I would feel safer if everybody would wear a mask because I love you all and I want us all to be safe, right? Something like that. It's important, how we say things to people as well, and that the way that we say it is going to be how it's going to be received. So just being careful about how we say it to our families, and always saying, it's because of safety and we care about each other. It's important to really get into the details of what is expected, right? So if we are going to have it outdoors, making sure that everyone's going to wear a mask, talking about all those details, right? Who's going to bring the hand sanitizer? Is going to be enough for everybody? If we're going to have the individual meals, like what is that going to look like? Really coordinating everything. And, we talked about earlier about the hugs and the kisses and all that stuff. And, for, some communities, like that's not how we do things. So really having those conversations about, this is why I can't hug you. I really want to hug you, but it's really for your safety and my safety to not do that. Because I think if we just wait for the day and they come for the hug and you're like, no, they're going to be maybe offended, right? So it's important to have those conversations. And they are hard. But I think also acknowledging, we're going to have this tough conversation today and normalizing, like, this is a hard conversation. Like, I don't really want to have it, but it's important for us to have it, I think is also something to bring up.
Yeah. Even though some people might take it a little hard,
yeah,
but it's for everybody's safety, right?
Exactly. And, it's about setting our boundaries too. What do you feel comfortable with? Sometimes we don't want to make other people feel bad, but it's really about safety.
Yeah, exactly. So, Dr. Storms, we still have some kids, like we're back in school, kids are back in school, and we still have some children that are still very anxious about, going back and seeing their friends, while staying safe. How can families talk about these tough situations with their children? Because it is hard to explain what's going on to the children and this is a very tough time for kids to try to understand why all of a sudden, why can I see my friends? Why can I hang out with my friends? Why I'm not going to school full time? What's going on? And so how can parents have this conversation with children so they're not so anxious?
So I think that what Jen was saying about having like an open conversation and sort of like normalizing the situation is really important. Especially for children, you want to keep the conversation to their developmental level and their age. So you want to make sure that you're using words that they'll be able to grasp and comprehend. You want to explain that, yes, in fact, there's COVID-19, there's a viral infection, and we want to be extra cautious. But then at the same time, you'd want to link it and letting them know that there's things that we are doing to keep ourselves safe, so that they understand that, doing outdoors activities has shown that the risk is minimized if we do outdoors activities. If we keep our distance from each other. So, And it can be hard, especially for young kids, not to hug their little friends, but sort of like having that as, and explaining that that can be a way to help both of you be healthy. And, sort of like putting more focus on the things that we're doing to prevent the spread, and that the school is also doing to prevent the spread with social distancing and things like that. I think that might be able to alleviate the stress, and that we do know a little bit more about the virus, compared to a few months back. Yeah, so I think, focusing on those positive things that we do know might be helpful.
Thank you. Jen, what if family members don't share the same views about wearing masks, social distancing, and etc.? Basically, how can I tell my family I won't be able to see them without hurting anyone's feelings? I think this is a little bit to what we were just talking about.
Yeah, it is. It is related. So again, it's about families have conflict about many things, right? So the first thing I would say is, how do you handle those conflicts, right? When you have those disagreements, right? So is it about changing someone's mind, or is it about setting our boundary? Because we might not be able to change their mind about them wearing a mask. We hope they would, but we might not be able to. So it's about setting our boundary, that we don't feel safe being around someone that's not wearing a mask. And their feelings might get hurt, right? So I think it's, again, how we say things to someone, saying, I love you, I care about you, but this is about safety, and, I want everybody to wear a mask. That's the recommendations by the Department of Health to keep us all safe. But their feelings might be still hurt, and that's okay, because families sometimes have conflict and we disagree on things. And, we give them a few days to kind of process things and reach out again, and hopefully they understand. But like I said, it's about setting that boundary, about how we feel about, what's going on and how we want to handle things. And I think that if we do it ahead of time and have those conversations now, and we don't wait until last minute, we have time to process everything. We have time for people to kind of be upset for a few days and kind of talk about it again, instead of waiting for the day before, when maybe someone is like, expecting, Thanksgiving or whatever holiday it is, that it's going to look a certain way. And then we kind of change things last minute. So it's good to do it ahead of time.
Yeah, thank you. Thank you so much for that information. I just wanted to remind all our viewers that we are open for questions and comments. If you have a comment or question you'd like to ask one of our experts, please just write it down on the comment below, and we'll ask the question at the end of the event. Okay, next question is for Dr. Storms. Dr. Storms, what should our viewers know about getting tested for COVID-19, and does my immigration status matter?
Yeah, so back to what I was saying regarding, COVID-19 having a very broad clinical presentation. I think the decision about getting tested or not can be, you can speak to your primary care provider or to your pediatrician regarding, if I'm having any symptoms, is it recommended? And if you are symptomatic, you should be getting tested and isolating for COVID-19 to get an accurate diagnosis in order to avoid spreading this illness, especially to somebody who might be at increased risk for complications. Now, and I think that at Thundermist we're doing a really good job with that, with setting telemedicine visits to discuss our options. And regarding testing and immigration status, here at Thundermist Health Center, we have the respiratory clinic where testing can be done, as well as clinical evaluation for patients. And the immigration status doesn't really matter, or it doesn't get taken into consideration for either the evaluation or the testing. the other thing to consider, and specifically for children, is that one of the things that the school is doing to keep children safe is they're doing a lot of testing. So if they have symptoms of COVID-19, they will be requesting having a test done. And through the kindergarten to 12, they have specific sites where children can get tested, and so we know whether these symptoms are related to the COVID-19 or not. And that also, if this child is in the school system, the immigration status doesn't matter either.
Great. So again, we don't ask any immigration questions to any of our patients that are coming in to get tested. Just so everybody's aware, you have to obviously call, and I'll get to that to make an appointment. But I have the last question for you, Dr. Storms, and it's also what we're doing right now. Why is it so important for people to get the flu shot this year?
Yeah, so I mean, definitely it's important to get the flu shot every year, but I think that this year especially, because as we know, influenza is an illness that we see, every year around this time of year, fall, winter is the highest peak for influenza, and influenza per se, just influenza can cause, certain complications. Now, if we're gonna be having both influenza and COVID-19 going on, one, you want to prevent having, the double whammy of COVID-19 and influenza at the same time, because that can cause many more complications. And two, you want to prevent having influenza, because both COVID-19 and influenza can cause very similar symptoms. So if you prevent influenza, you're going to be having less cases with, upper respiratory infections, fevers, things like that mimic COVID-19. So we're going to be able to as healthcare providers and as patients not be as concerned regarding influenza, and as concerned regarding you having an illness, and making sure that you get the COVID testing, because you're preventing influenza with the vaccine. I don't know if that made sense at the end.
Yeah, and then it's the symptoms are pretty, there's a lot of similarities, with the symptoms. So
Exactly.
we should definitely, go get our flu shot. Reminding everybody, all of viewers, come in, get your flu shot. We at Thundermist, do you want to talk about a little bit how we do the flu shot at Thundermist?
How we do the flu shot?
Yes.
Like,
can anyone come in and get the flu shot?
I'm sorry?
Can anyone come in and do the flu shot?
Yeah, so I'm seeing a lot of well child checkups, so we're actively seeing patients in the clinic for well child checkups, and we're getting all children caught up with immunizations, including the influenza vaccine. If they're not due for their well child checkup, they can come to the clinic for a nurse's visit or through convenient care, and they can get the vaccine there.
And I believe there is no need for an appointment for that. Is that correct?
So if you go straight to convenient care, you don't need an appointment for that. If you prefer to have an appointment, you can do a nurse's appointment and get the vaccine.
All right, that's great information. So everyone, you don't need an appointment to come in and get your flu vaccine. You can just come into convenient care and get your flu shot. We do have a couple of questions that came in from our viewers, and one of them, it says, how can you ask your family to get tested before they visit? So I think we'll go with Jen. What do you think? How do you tell your family member to get tested before they visit?
Like the conversation that you have to have with them? Is that what you mean?
Yeah, so, how you basically have family members coming over and you're like, oh, can you get tested first? How do we?
Well, I think a good place is to kind of defer them to the Rhode Island Department of Health, like recommendations, and saying, if we are going to gather, like this would make it safer for everyone. But I think it really all depends. It kind of goes back to everything that we've kind of talked about. This is kind of broad, like, do they live in Rhode Island? Are they coming from somewhere else? So that's kind of I don't know, a complicated question. But for having the conversation with them, I think back to going with, I love you, I care about you. And
if they're coming, Jen, I'm sorry, if they're coming from a different state, for example.
If they're coming from a different state. Then, like I said, I think it's, if you're focusing on safety and, about risk, and this is, something that would make us feel safer, that's how I would recommend you starting the conversation.
And it's also the CDC recommendations, correct?
I'm not sure about that.
If you're coming from a state that has a high incidence and prevalence of COVID-19, they do recommend either, like testing or quarantining. Because even,
Yeah. Okay, thank you so much. I do have another question here. Somebody saying that, masks are expensive. So I would like to actually say that Thundermist offer masks. We are giving away masks. All you have to do is you have to come to any of the Thundermist health centers. You can go to the convenient care, and you can go from 8 a.m. to 8 p.m. and that's Monday through Friday. And we have different hours on the weekends. So we are giving masks for free to patients, okay? You do not have to be a patient of Thundermist. You can just come on down and request a mask, okay? So we have that for the community, and that's for Woonsocket, West Warwick, and South County, okay? So so again, if anyone has any questions, please write down in the comments. But at this time, I would really like to appreciate, to thank both of you for taking your time out of your busy schedules to be here with us at another Ask the Expert event. Thanks again, Jen. Thanks, Dr. Storms, for taking the time as well. We really appreciate it. And I hope everyone enjoyed getting to know our wonderful providers, and we hope we were able to answer your questions. And please remember how important it is to get your immunization during this pandemic. Please give us a call at 401-767-4100 for an appointment. It's especially important that everyone gets their flu shot this year. Again, reminding everyone again, flu shots will be available now in the fall, so we're ready. Okay, and again, Thundermist is accepting new patients in all ages. Just give us a call to book an appointment. Again, at 401-767-4100 for an appointment. Okay, so again, thanks both of you for being here. Thanks all our viewers, and we will see you again for our next Ask the Expert, and have a good night, everyone. Thank you.
Thank you.
Stay safe, everyone.
Bye.
Bye-bye.